As individuals age, they inevitably become at greater risk of developing the condition of altered mental status. In fact, it's suggested that nearly 6 million Americans above the age of 65 live with Alzheimer's disease, a type of altered mental status. Although it is a common occurrence that elderly individuals can develop changes in mental status, it cannot be presumed that this is simply related to the aging process. The mental status changes will likely fall into a particular category of dementia based on the characteristics of the condition. In geriatric medicine, this altered mental status is defined by a change in cognitive ability or conscious understanding. In what follows, we'll be detailing the most common types of altered mental conditions, particularly as evident in geriatrics. We'll also define the causes, symptoms, and signs, as well as potential treatment and management protocols. Common types of altered mental status. An altered mental status is quite common amongst the elderly, with age being a leading risk factor for such developments. To illustrate its commonality, Alzheimer's happens to be the 6th leading cause of death in the United States for adults over the age of 65. In order to manage and potentially treat these altered mental states, it's important to first understand and evaluate them via their unique characteristics, signs, symptoms, and causes. The following are the most common types of altered mental conditions as seen in geriatric medicine. Vascular dementia. Alzheimer's disease. Geriatric delirium. Dementia is a slowly progressing mental condition characterized by a loss of memory and total mental capacity. It leads to a complete deterioration of cognition and understanding, ultimately resulting in rapid changes in behavior and mental status. Two categories of dementia often seen are vascular dementia and Alzheimer's disease. Vascular dementia. Vascular dementia is a form of dementia that develops in individuals who have cerebrovascular disease or impaired cerebrovascular blood flow. It can occur in individuals who have had a stroke or in individuals who have impaired cerebral blood flow but have not had a stroke. Alzheimer's disease. Alzheimer's disease is a brain disease that shares similar characteristics of cognitive deterioration resulting in memory loss, behavioral changes, and other skill-based abilities such as motor movements. In fact, Alzheimer's disease happens to be the most common cause of dementia amongst the elderly. But, notably, Alzheimer's is very rarely diagnosed in young and middle-aged adults. Geriatric delirium. Affecting many geriatric patients annually, delirium is a condition of confusion characterized by alteration of cognition and consciousness. Individuals with this condition will have a rapid change in their mentation in a short period of time. As a result, they tend to have difficulty with memory, orientation, and ability to speak coherently. The rapid change in cognition is the key point differentiating delirium from dementia. It's therefore important to identify the individual's state of mind prior to the development of the new symptoms. It's important to identify an underlying medical condition that can be causing this state of confusion in the elderly individual. Such conditions as urinary tract infection, dehydration, medication withdrawal, or alcohol-related condition can lead to similar symptoms. In addition, elderly patients in hospitals can experience the condition of sundowning in which the individual experiences behavioral deterioration in the evening hours. This phenomenon often has no medical-related illness causing it. Other altered geriatric mental impairments that result in altered states include sepsis, depression, bipolar disorder, schizophrenia, and even coma, a more extreme dysfunction of cognition, consciousness, and arousal. Treating altered mental states, particularly in the elderly, depends on the origin of the specific condition. Regarding conditions under the category of dementia, certain therapies and drug prescriptions are available to treat the decline of cognition and behavior changes. The success of these specific treatments varies from patient to patient. Treatment of delirium will involve first identifying if there is an underlying medical problem that is causing the condition. If an underlying medical cause is not identified, treatment by a mental health professional will be necessary. Social support, particularly from family and loved ones, can play a major role in the treatment and management of the progression of such mental ailments. By providing encouraging and positive environments for those living with altered mental states, the quality of life can also be improved. Final thoughts. Altered mental status conditions in the elderly are quite prevalent, and unfortunately, there is no specific cure for various forms of dementia to date. These conditions require a planned effort of caretakers to help to care for elderly individuals with this condition. One of the most important issues to manage is the safety of the individuals since they are at risk of falls, auto accidents due to impaired driving, and other in-home accidents. In addition, attention to specific health issues such as adequate nutrition and social engagement are especially helpful in the care of elderly individuals with these conditions.